So I realize this is the most boring title ever. You know, you send your title in weeks in advance, not knowing exactly what it is you're going to talk about. So I'm talking about this a little bit, but then talking also about some of the other themes that we were asked to speak about our kind of personal experience at the center, and how our research has been affected by it, and what some of our future research trajectories are. So like the other talks this morning, there might be some history that is incorrect, but I think it's pretty right, because I did some fact checking earlier today. But first and foremost, I just actually want to say thank you to CDHA and all the faculty in CDHA and CDE and my fantastic fellow students back in the 90s, really for affecting my life in really powerful ways. I have studied aging basically since about my third year in graduate school through today. I edit Journal of Gerontology. I've written a lot on aging, and I work as a co-I or PI in a variety of different aging surveys, and I've been very, very lucky to work at lovely places. And I attribute that almost wholly to the wonderful support and training I got here at Wisconsin. So I'm incredibly grateful for that. So I'll talk a little bit about how it all began, at least for me. I have a sister who likes to make scrapbooks, which we kind of mock, but there's a good thing, that I actually have things that are really old. And so years ago, I was sitting back in my apartment in Hoboken, New Jersey, and this letter appeared, signed by Bob Hauser, in my mailbox. And it offered me financial aid to come study here at the University of Wisconsin-Madison, an RA-ship on the Wisconsin longitudinal study, which I did not know what it was at the time, but I said yes. And this was in an era before you would come out and visit and be wined and dined. I was like, yeah, sure, I'll come to Wisconsin. I never visited. I shipped 10 boxes of largely shoes and clothes from Hoboken, New Jersey to Wisconsin. And my life here began. And working on Wisconsin longitudinal study again taught me so much and opened so many doors, and just kind of planted the seed for research projects that I've done that build on the WLS in ways that maybe it wasn't initially envisioned. So I came here funded to work on the WLS, but a couple years later I was moved into, which I fact checked with Bob this morning, one of those first CDHA traineeships. It wasn't part of the center yet, they were kind of these spin-offs. So we constructed that it was me, Diane Schinberg, and then Bill McGee, who was the postdoc at the time. And so I feel really fortunate to have been kind of a precursor of the CDHA traineeship program, which has been run by all of you, who you've heard, and now has a whole new cohort of really terrific young scholars. So that's how it all began. And I came to Wisconsin, ranked the #1 sociology program in the country with all these really bright people, moved here sight unseen. And when I first got here, I was terrified for a realm of reasons. Reason #1, I moved here the first week of July in 1991, the week that the national news story was Jeffrey Dahmer murdering people in Milwaukee. This, of course, all my friends and family were far away, like, oh my God, you're moving to Wisconsin, you're going to die because of Jeffrey Dahmer. And I was like, no, I don't go to gay bars where he was killing people. I wasn't in Milwaukee yet. So once I kind of adjusted to the fact that Wisconsin was so much more than the Jeffrey Dahmer murders that were publicized the week I moved here, I started in July going to the CDE summer seminar, DEMSEM, right? Some of you have heard this story before, but it was my very first time here. I had done no math really other than calculating tax and tip for 5 years before showing up here. And the first presenter was Ray Long, who's a very sophisticated statistical modeler, and he has all these numbers that look like that up on the then overhead. And I had no idea what was going on. I could feel tears welling up my eyes. I made this bad choice. I don't know what the hell I'm doing. And this older grad student slid over a piece of paper to me that said, don't worry, no one else understands either. And it gave me a tremendous sense of solace. So starting with that kind of inauspicious beginning, I learned that CDHA and CDE were more than just statistics, although certainly doing the highest quality, rigorous, empirical work has been a hallmark of all that comes out of Wisconsin. But from that start, I learned a lot about methods. I also learned a lot about theory. Even though Bob always says he's not a theorist, he does measurement, not theory, I think is the quote that we would hear in grad school. But I started studying aging in the life course, and there were two really big themes of aging in life course. There were actually four, but I don't have time, so we're only going to hear about two today. The first one is this theme of time and place, that individuals and birth cohorts are influenced strongly by historical context and specific location. And that was certainly, for me, great fortune of both history and location. And then linked lives. Our lives are interdependent, and there have been so many collaborations among students and faculty here with the other affiliates at Wisconsin. And then once we all leave here, we continue to collaborate. So that's something that's been, again, for me, really quite wonderful, not only within sociology, but other related fields. And in this way, I think it makes our work as creative as we hope it can be. So on that first point of just being in the right place and time, I kind of feel I was stunningly lucky to be at the right place at the right time. I came to grad school in the 90s. As you heard earlier, Richard Sussman was head of a whole variety of things, but at the time that he was fueling and starting all of these fantastic studies of aging, longitudinal studies of aging, investing in review articles and books and volumes on demography of aging, was when I was starting my training. So again, this was just really quite fortuitous. And it was also fortuitous that I came to graduate school when the WLS was starting to go into the field in the early 1990s after not having been in the field since the 70s. And the study was going in new directions and expanding its focus from a study of social stratification to physical health and mental health and family relationships and a variety of other topics that I continued to work in since that time. So definitely it was good fortune going. But now to bring back that letter that I received offering me like $13,000 a year, which seemed like a gold mine at that point in time, there was a paragraph here that said most center students maintain strong interests in one or more specialty areas outside of demography. And I think that's something that has shaped many of our lives coming out of CDE, that we all do demography, we're trained in the methods and have that rigorous way of thinking, that we're obsessed with selection, this is just part of our breathing. But also we do other things like social psychology or family sociology or stratification. And I think in bringing in these other areas of study, that helps us to take our research in directions that is new and hopefully exciting and hopefully interdisciplinary. So just to give one example before I get to the depth stuff. I was very fortunate that I worked not only here, but with Institute on Aging folks like Carol Riff. And this is just kind of one example of a little project that becomes a big project, and kind of a little bit of fortuitousness, and then just kind of seeing work develop. So the Wisconsin longitudinal study, as you heard about, is a survey, right, with closed-ended questions. But Carol Riff and some other collaborators got some research money to go into the field and do in-depth interviews with some, which generated really interesting qualitative data. Again, maybe not something that was envisioned in the start of the study, but it was something that led to some projects that I thought were quite new and interesting. So I wrote a couple of papers using the quantitative data from WLS along with these open-ended interviews, really asking this question of, for that generation of men and women who had pretty rigid lives when it came to compliance with gender roles, that men were the breadwinners and women were primarily homemakers up until the time their kids left the home. When they engaged in life review, did they feel envious that their siblings, kind of Gen X and Gen Y, had so many more opportunities, and they have that opportunity to traverse gender boundaries and kind of do more of what they like in life? And so I wrote a couple of papers of that based on WLS, finding that in fact the parents weren't jealous at all. They kind of took pity. The WLS parents kind of took pity on their children who were born in the 60s and 70s, thinking that women trying to have it all were just stressed out all the time, that they're trying to do 12 things, whereas their older generation who specialized in one thing felt less stressed out, essentially. And for the men, they thought that their sons were kind of unfocused. This fact that they could maybe rely on their wives' income or kind of do whatever kind of job they wanted made them less disciplined and less focused. So it was kind of these interesting findings that the media picked up on for a variety of reasons, and it led to a freelance journalist contacting me to write a book about this. So again, it's thinking about these ideas that started in the halls of this building and taking them in ways that speak not only to other academics, but to the many other people in the world who aren't academics, who care about their lives, who care about aging and intergenerational relationships, and can learn from the research that we're doing in this hallowed building here. So that's one direction my research has gone. But now kind of bringing it back to demography a little bit more squarely. That I think demography for many of us, even if we aren't and are formal demographers. Demography is the foundation that identifies trends and patterns that gives rise to so many other questions that we want to answer. And I think that's another distinguishing trait of both CDHA and CDE. We're not all being trained just in formal demography. We had to do our life tables and Beers multipliers for Alberto, I think it was. I still have nightmares that I failed that class, but we did have to get really technical things in our Dem Tech class, right? But we have all those skills as they do in other programs, but we also have access to so many other academic disciplines and programs to help us move beyond the technical demography. So way back when I was taking 663 with Hal Winsborough, we had a very large stack of readings to read, as I suspect you still have to do for Pop and Society. We read the famous Omran article about the epidemiologic transition. And this is something most people here know, and everybody who studies demography of aging knows this, that there's been just a tremendous change in mortality over the past half century or so. Death has transitioned from something that happened early in life, and it happened fairly suddenly, whereas today most people die at a quite advanced age of a chronic condition that lasts a long time. Oftentimes you have a long period of forewarning, knowing that you are going to die. And that period is filled with strain for the dying person, but also for the family caregivers. So this article actually really stayed with me and has laid the foundation for a lot of the work that I've done since that time. So we know what the demography tells us, but I was interested in what happens in families and what happens in terms of psychosocial well-being. And so it generated this question in a box here that's generated a lot of the papers I've written. So how does this kind of anticipated, prolonged, and even painful and somewhat controllable period of end of life affect older adults and their families? So I'll give a couple of research findings, but again, these research findings I think really were launched here in many ways. And so I ask questions building off of what I learned in my various demography of aging courses here. And one is, again, now knowing that people die after a long time period, what does that mean for their family members, right? Is it worse to have someone drop dead suddenly or to have someone die after a long, prolonged illness in which we witness their suffering? So I've done a couple papers on that, with a different data set that's not headquartered here, but that's okay. And I did in fact find that there are two paths to death. It's equally bad to have someone die suddenly or after a prolonged time period, but the symptoms that one evidences are really quite different. People experience more anxiety, for instance, after they've had a long drawn out death because the wear and tear of the caregiving has kind of undermined their capacity to cope, whereas a sudden death leads to things like intrusive thoughts, right? This kind of shock that one can't move beyond. And again, this highly psychological question, I don't think I ever would have come up with if it weren't for all the learning that I did about demography of mortality and aging. Then another question, again, getting back to the research that was generated from here, what I learned at CDA. Again, those of us who've read this article know that there's a term called man-made disease, right, which we always found kind of weird, that death went from being something kind of natural to something that was shaped by the environment. But a big theme of how people die, in the late 20th century is that we do things that hasten our death, right? Smoking and drinking and carrying too much weight in certain parts of one's body. And it was always kind of a text of almost self-blame, I thought, in some way underlying some of the rhetoric of the Omran article. But it again got me thinking about this question here. I'm going the wrong way here. If in fact there's public knowledge out there and news telling people that if you smoke and drink and don't exercise enough, you will increase your risk of death, which we know is true. How does that affect people coping with chronic illness if they know that they in fact have done something to bring on that condition? How do family members cope? How does one cope with this death of a smoker who dies of lung cancer? So I was very lucky to have some data that looked to see whether individuals kind of hold their late spouse partially responsible for their own death. And I find that, it is more difficult if someone attributes the death to something that their spouse did. They tend to yearn less. They often have poorer quality marriages. So there's something very distinct about how we die that shapes adjustment. So those are a couple findings of research. But then also, all the stuff I learned about mortality here raised new questions that now you see a lot of research on, but I was we're very lucky to kind of get in early on this body of research on advanced care planning and end-of-life planning. Right? We know from what we learned in 663 that death is anticipated more because people are dying of chronic illness today. And so that got me thinking about who plans for end of life and who has a living will and who do you choose to make decisions for you now that we're at this first moment in history where we have that opportunity to do so. But at the time I started thinking about this, it was very little data. This field was wholly owned by the medical people. And so thanks to Bob and to folks on WLS in the 2001 survey, he allowed me to put in this module of questions about advanced care planning. And again, I'm very grateful for that because these questions that first appeared in the WLS now have been replicated in the surveys, of which the PIs are all basically friends of ours, so they're willing to replicate those questions. ACL, HRS, and HATS, a lot of the surveys that Bob referenced. So again, it speaks to this fact that the aging community is very large and we have these ties that allow us to compare and contrast and benchmark across studies. Also, just bringing back this life course context, I think part of the reason that maybe Bob allowed me to put these questions on the WLS and the fact that publications and collaborations came pretty easy was, again, bringing it back to timing. And there was, having the Survey Research Center here allows us to do things nimbly, to ask questions in a fairly quick fashion. And so the time we were writing those questions was the time of the whole Terry Schiavo crisis. But then also there was a nursing school professor, Karen Kirchhoff, who was very instrumental in helping to develop these questions, who had ties to the famous Gunderson health system in, what's the name of that town again?
Eau Claire or
Lutheran place. La Crosse, exactly, La Crosse, Wisconsin. This was a very famous kind of medical trial that was happening around the same time. And again, these ties that we keep hearing about to other units on campus really helped to launch this work. And so just again, more findings that I have about advanced care planning is something that I found in a variety of papers based on WLS and other surveys, that this is an engine that helps that drives disparities in the quality of death. The lower income persons, African Americans, and Latinos are less likely to kind of articulate the kind of treatments they want at the end of life, and that's an engine, again, driving disparities in the quality of death. So those are just a bunch of papers, a lot of which were done with the WLS, and a lot of which were done with future CDHA trainees like Sarah Mormon. So next steps, I'll just kind of, one of the questions we had is what's your next project? What are some of the next things to study? In the interest of time, I'll make this really short. The thing I have my head in now is actually something I got from here, kind of my training in stratification and family demography have got me thinking about this and just kind of writing one theoretical piece that'll be out soon. About thinking about, we talk a lot about cumulative disadvantage and cumulative advantage, and as Bob mentioned, inequalities early in life have really long-term effects. And I've been thinking about the role of family, and this seems so straightforward, but I haven't actually seen it written down yet, that our family relationships are a key engine that drive the disparities between the haves and have-nots from early on. Right? Marriage, as we know, has become increasingly an institution of economic and racial privilege, and marriage brings all kinds of health benefits and economic benefits in the longer term. Social Security benefits, which help to keep older adults out of poverty, are structured in such a way that they benefit people who have kind of the white middle class family form, which is a long-term marriage, and marriage that ends in widowhood rather than divorce. Then all those family strains that take a wear and tear on one's pocketbook and one's mental health are those that specifically befall lower income people in greater numbers, things like custodial grandparenting, for instance, having to do very difficult caregiving without being able to afford an outside helper. Let's see, marital dissolution, marital abuse. And so this is kind of a new thing that I'm thinking about right now, where my head is, and I think it just really was launched in many ways from the training that I received so many years ago here by the aging researchers, the social stratification scholars, and then the family demographers. So that's just kind of a little overview of what I've done and how I think it speaks to just the strengths of what CDHA has done for me and for so many other people. Getting back to Link Live, I was going to make a slide to list all the people I am grateful for both kind of friendship and support and collaboration. And it was just like a ridiculous number. So rather than name everybody, I thought I would just mention two people who were really just pivotal to my experience here, and I think many other people, Tess and Hal Winsborough. And if I was a little more on the ball, I would actually also include Sandy Reamer, who was instrumental to so many of us in graduate school in helping, again, to keep us sane when the strains of grad school got a little bit much. Take questions.